This is going to be the first book review in Ryan's Book Corner. I'm going to be going over a lot of different books I'm reading currently to improve myself and for self-improvement. And I'm going to go ahead and give you guys the best summary I can. That's not only a summary of the book, but also the most actionable tips you can take. We're starting off with Better by Atul Gawande. He's a South Asian surgeon who is able to talk about his experiences going back to India and helping with public health and vaccines for polio, as well as analyzing and interviewing a lot of people who work in the US military as surgeons. And really this whole idea of better comes from how do people improve, right? And why do they improve? And under what conditions can they improve? It is definitely like a medical book, as in a lot of the, things he references are like medicine based. He talks about like hospitals and different systems for improved hand washing from doctor's side and a lot of that. So I'm just going to give you a lot of the direct kind of, takeaways I had. There's a lot of good anecdotes in here. I don't want to spend all the time on them because I think that a lot of it just matters of what you take away, and I can just kind of explain what I have there. So I have a couple notes I'm going to be looking at. So I think one of the things we see in the beginning is he talks about the situation where there's a hospital, and they discover that in the hospital, they're actually spreading disease partly to their patients through not always washing their hands on the doctor's side, which seems crazy. But the reality is these doctors are seeing so many patients a day, and they don't always have time to like thoroughly wash their hands. Now, he goes through the process of how innovation in this field kind of worked, and that eventually they switched to more alcohol gel, like sterilizing creams, which were put outside of each patient's room. But even then, he said doctors often didn't find themselves using them. And like, what is the reason? So I think one of the big insights I had from this kind of story was that in order to achieve success in whatever field, right, if you're working on a team, you want to ask the people who are most involved with the problem to come up with a solution. So they take ownership in it, and they also help see its success through, versus you being a leader coming in and presenting a solution that may not work because of your limited insight. This really was shown in the hospital example because the only successful case where they were able to get people to like hand wash was through somebody coming in, talking to like almost everybody in the hospital, talking to the care team very thoroughly and asking them a lot of questions of what can be improved. And by giving the care team a voice, this allowed them to actually, make the hospital care team, not just the leadership that was governing it, right, saying like, oh, you need to wash your hands more. That's something you need to do, right? But by taking in their inputs and creating a system and creating a solution that was backed off of the actual care team, now a lot of nurses were in on it, and they were also part of the supportive ecosystem, and they would also really push doctors and remind them. And that was really the key, is once you have all these players all in on it, then together you can create this community and this culture of, using the alcohol gel to sterilize, right? Whereas before, it's like, if the nurses aren't really helping remind the doctors, and the doctors aren't even in it themselves, and they're not being checked by other people, it becomes very hard to push. And sometimes you have one or two people who really care and will always do it right before they see a patient. But that's not always the case. And so it's like, whatever situation you're in, you want to realize that as a leader, it's not the fact that you are a leader that you have the power. The problem is, you as a leader, you're very distant from a lot of things that are happening within an organization. And the result from that is that when you make some decisions, they may be bad because you just simply do not have insight. So try to talk to more people who are lower down, right? Who actually work with whatever you're trying to solve day to day. They can give you a lot of incredible insight. And also, if you use their insight or even just hear them out, they'll be much more supportive of you, because most people, most leadership just don't even consider what other people have to say. And that's why a lot of people resent the policies that they pass. Another part of that is just when people have a personal stake in the success of an operation and they believe strongly in team culture, they will go above and beyond to improve the status quo and ensure success is achieved. This is what we saw in this case. Not only were the changes implemented, they were actually kept long term because of the fact that a lot of nurses supported the doctors, and the doctors also were in on it as well. And you had this just very positive culture and environment. Additionally, another part he talks about a lot is the social dimension of medicine is often overlooked and overshadowed by the emphasis of pure knowledge. A lot of the improvements that he talks about in this book actually come from things that we already know we should be doing. For example, the hand washing. He says it doesn't make sense why we don't have a 0% rate of, just like transmitting these diseases, because shouldn't everybody just be hand washing or using those alcohol sterilizing gels? Like, that's something we already know how to do. That's not something that needs to have a breakthrough in science, right? This is it's like an operational thing that if we could just have better management of these hospitals and better incentives and better setting up of the culture, we would be able to achieve better patient health just through simple things. And these are the simple things that people often overlook, but they overlook them not only because they're simple, but because they're very actually hard to implement, and that you need to be a very skilled person to see, okay, what can we change to, improve the status quo? Because the reality is most places all around, right, they're all just, doing the exact same thing, right? They're all just not, washing their hands, and that's just like how it is, and nobody really does anything to like change that. And as a result, that's just how it's been for a long time. So you really have to come in with a new novel insight of how we're going to change this. And a lot of people have failed in the past to try to increase hand washing. But one of the examples was like, there was also these patients with like cystic fibrosis, and they were trying to study, okay, what did the top care teams around the country do? And like, how were they different? And so the reality is, like, if you go to, let's say, a specialty center for cystic fibrosis, you're not always seeing the best. You have to like actually evaluate them, and they need to be like transparent with their data, how well they're actually improving their patient's health. But it's not really published. But eventually, they like started publishing it, and then so he talked to some people working on that, and the people who were really successful in like helping a lot more patients stay alive the longest were just very, very detail oriented, in that they would ask the patients a lot of questions. They didn't have novel diseases, novel drugs. They just asked the patients a lot of questions, got to really understand exactly why certain things were happening in their life, tried to give them pretty good solutions that weren't necessarily breakthrough innovations. And that's what really made a big difference for them, because they talked to patients so much, because they heard them so much. They took all this information that they got and were able to use it to try to find a solution, rather than going the other way and say, hey, I'm the doctor, I know everything, I'm going to give you what I believe is correct for you, and not listen to like what else you have to say. That leads to a very negative situation, because you're not listening, and also you're not really fixing the problem, because you're not listening for what the problem and how it's changing over time. And yeah, so the art of human interactions is crucial for medicine, but almost never discussed, right? So people want to be heard and have their thoughts and ideas at least considered. This is a fundamental truth of all human nature, right? Then he also goes a little bit into medical malpractice, and he talks about why medical malpractice lawsuits in the US, he thinks, in his opinion, are very not beneficial for anybody. So medical malpractice is when a doctor makes a mistake and you have a patient who goes and sues them and tries to, just like get money in a sense, usually, and just get reparations for whatever mistake happened to them, right? So in his opinion, right, he thinks that the problem with doctors is that they like do so many things all the time, right? So for surgeons, they do so many different surgeries. And because we're all human, right, it's bound to have some mistakes, whether or not we accept it or not. Of course, no one wants mistakes to happen, but they're bound to happen because of just the chance of doing so many different things, right? It's like if you are an NBA shooter, right, you're really good at basketball and you shoot like 1,000 3-pointers, you're not going to make all 1,000 because something is going to happen. Even if you're super good, even if you can't miss, you're still not going to make all 1,000 in a row. Right? And that's like a similar situation to what these surgeons are in. They're trying to do their best. They're being supported by great teams and staff, but they're not always going to create just perfect results. And so as a result, medical malpractice lawsuits follow that. And he says it doesn't really help anybody, because the truth of the matter is, you get money. If something happened to a patient, the money is not going to help, because, money doesn't just fix health. Health is a very tricky thing, in that money sometimes can improve healthcare, but it only does to a certain point, and you can't just pay $1 million to cure yourself of some disease. That's not how it works. And so at the same time, though, it really punishes doctors for making these sometimes small mistakes, sometimes large mistakes, but regardless, they're mistakes. And I think unless doctors are inherently, trying to hurt people, which typically that doesn't happen, it's very difficult, because now you're making them afraid of even just operating on people, because they have to pay for this medical malpractice insurance. They have to, be wary about, is this person going to sue me after I'm done just because they don't like how this thing looks, or they don't like this particular part. Sometimes there's cases where they save patients' lives and patients still come back and sue them. So it just creates a very, very negative loop. So he talked a little bit about that as well. And he also talked about how in New Zealand, these medical malpractice lawsuits don't exist because they take a percentage of the cost for every operation, and then they put aside a nonprofit fund for any patients that, let's say, do have a mistake happen to them and they have to deal with those losses of either limbs or just like health. There's a fund that has money as a nonprofit that's able to support them just for that cause. And I think that brings out a lot of like, it just reduces a lot of the emotions that are tied to the inherent nature of medical malpractice lawsuits. And then he also talks about, the difference between doctors doing too little and too much, right? So this is one takeaway I kind of had from what he was saying is pretty much we want doctors to fail by doing too much. So we want them to do as much as possible and then fail rather than doing too little, because at the end of the day, we can hide behind the comfort of giving it our all and saying this doctor did everything they could, right? Versus living with the unknown possibility that we could have helped and we didn't. I'm saying we as like a doctor, right? So I'm not a doctor yet, and as long as there's a chance it will help, we should. Now this comes into a very big gray zone that he talks about, because there's some situations where it's like, where do we keep going? And some nurses have very different opinions. They believe the doctors keep pushing for no reason. And they like say, in their opinion, some doctors should stop and they should just let the patients kind of, rest and not keep going through so rigorous treatments and things like that. But yeah, I think that's a very important point, because as the patient's family, it's something they have to really consider. They have to consider, okay, are we going to keep trying for this patient even when it seems like it's not really helping and they're in a lot of suffering, or are we going to, take the alternative approach? And then something that like I think is kind of important is also having more additional alternative treatments to just modern medicine. So if you go back to what I was saying earlier about we want doctors to fail by doing too much, well, in my opinion, I believe that, after doing XYZ different treatments, if those are not working, you should then explore alternative treatments that are more maybe diet focused or exercise focused, or, maybe something like acupuncture. Like a lot of those alternative treatments, yes, they may not be the best things initially, right? They shouldn't like replace modern medicine. But if you're in the situation where A, B, C, D hasn't worked, then you go to E, I think you should still go to E. But I think that's a big issue with today's modern medical system is there's no space for alternative treatments in most hospitals, and they just stop at D, which is the last pill that they can prescribe, and then they just stop and they say there's nothing else they can do, which not all alternative treatments will help people, but a lot of alternative treatments could potentially help people. And I think that percent chance is something that's worth looking into. Additionally, he talks about kind of the importance of ego in medicine. And something I took away was like medicine only gives doctors bigger walls to hide their personalities behind. Without humility and good character, doctors will make poor decisions to protect themselves. And I noticed that, like, you hear me say this, and I'm like, oh, doctors are bad, all this stuff. Well, the reality is all people will do this, right? All people do this in all aspects of life across many professions. They all make, poor decisions to protect their ego. And doctors, unfortunately, are no different, right? I think the key is that, like, we want to try to limit that as much as possible. So it'd be great to have doctors that are very humble and just very, just like clear on what they're doing and open to being wrong and being like vocally just wrong and say this is the wrong thing and I need to do something else. But that's unfortunately not really the reality we live in. So yeah. And then another takeaway is that constant experimentation, evidence collection, and iteration are the key to any success in any field. Anything from entrepreneurial pursuits all the way to medicine. Because he was talking about how a lot of these big solutions come from being data-driven in the sense of like you try something out, you collect evidence on it, and then you try it again. With the cystic fibrosis patients, the one doctor developed this machine that like thumps on their chest to help with loosening up mucus so they can cough it out. This was something they had only done through a lot of different testing and realizing this is something that could be actually helpful for the patients. And once they did that, then they eventually developed the technology to build this kind of machine. But this is something you can only get from actually trying something out. Here's another takeaway I had. Better to take quick, imperfect action to get results quickly and iterate than try to take perfect action but wait, because you will iterate faster and reach the solution sooner than if you try to plan it all out. The truth of the matter is by trying to plan it all out, you will fail because you do not know the whole situation. But by trying and then failing and then trying again, you will gain more information, gain more knowledge, and you'll do so faster than making a long, elaborate plan and then trying that one plan out. A big thing I think the whole medical system needs to realize is patients actually know a lot more information about their condition and have significantly more insight and details than the doctors do. Doctors are trained on a lot of textbooks, which are generalized situations, but each patient is different. And I really wish that in modern medicine, we had the time to spend more, time with each patient to really understand their subtle nuances, because I think we learn a lot more. The difference, okay, this is a great takeaway I had. Quote, the difference in 80% chance of success and a 20% chance in success is in the 0.05% chance each day that compounds over time. If you do something or you don't do something and it only results in a 0.05 chance difference each day, that results, when it's compounded each day, again and again and again for a year, that results in an 80% chance of success versus a 20% chance of success. So such a minute difference eventually leads to success. Think about, just like one donut a day versus, one broccoli a day, right? That's one good example. It's such a small decision, but of course that has a very profound effect in the long term. The smallest changes, if repeated, lead to the greatest results over time, including for medicine. Executing care, like we're talking about patient care, based on skill and knowledge alone produces mediocre results. You need open eyes and to actually care about ingenuity to improve and make the best situations. Just because doctors are trained and they're skilled and they know what they're doing doesn't mean that they're ready to always improve and fix the system and make it better. You have to have a doctor who is trained but yet also flexible to understand that the situation can be improved and open to improvement. Medicine has an execution problem. There's a list of things they can do to improve that will make care better, that do not require new discoveries, just better operational efficiency and intentionality. This is, I think, one of my biggest takeaways from this book, is that by doing a lot more of the simple things better, we would actually be able to fix a lot of the other things. Another example he has in this book is about mammograms and breast cancer. He says that by increasing the number of mammograms that people get per year, or just actually not increasing, just ensuring everybody, above a certain age has a mammogram once per year, because he says this current statistic is that one person will have one in 7 years. So as in they're not having one each year. They typically have one every 7 years, which is not good. He's saying just by doing that alone, we could catch more breast cancer. And then we would be able to treat them better and then, just have a better outcome. But because we're not focusing on that, we're spending billions and billions of dollars in the US on better breast cancer drug development. But he says if we just tried to, capture more of the breast cancer that's out there and diagnose it earlier, we would actually do much, much better. But of course, that's not glamorous, that's not glorious, and nobody wants to just say, oh, actually we can save more people if we just, screen them more. But instead they want to develop new drugs because it's exciting and it gets money. So those are my biggest takeaways from this book. I definitely like a lot of the stories in here because I think there's some really profound impact that I had, and he has a really great way of writing. So I'm really excited to share this with you. Let me know if you have any comments or questions about the book down below. And I have a couple other books that I'm going to be reading. This is a sneak preview to the next video I'm going to make. It's going to be from this guy here, Naval Ravikant, The Almanac. And also we'll have other stuff in the future. So I'm just trying to take you guys along with me and share everything I'm learning through reading these books. If you're not reading right now, I highly recommend you start reading because this is the best form of leverage. You can leverage other people's time, their experiences, their knowledge. This doctor literally went to India for 6 months. He talked to all these different professionals, all this stuff, and it's all in this book. And I don't need to go to India. I don't need to talk to these other professionals. I can just read this and get as much knowledge as I can. So if you have any questions, put them down below. If not, make sure you subscribe for more videos, and I'll see you in the next one.